our mental health is equally important as our physical health. Now, mental health includes emotional factors, psychological factors, as well as social well-being. It affects how we feel, how we think, and how we act. Mental well-being describes how you're feeling and how well you can cope with day-to-day life challenges. It can change from moment to moment, from day to day, month to month, or year to year. And so when we look at mental health as a whole, we find that mental health is not specific to age. It can affect any one of us at any moment in time. It can affect young children, adolescents, adulthood, but also older age individuals. And so there are certain environmental triggers that may increase the risk of an individual developing a mental health condition. And this can directly impact an individual's thinking, the way they feel, but also the way they react, not only to that event, but also future events. So it's really important for us to focus on mental health today. So upon reflection, I've been doing a little bit of reflection, and I find that mental health difficulties is a medical problem, just like when we have heart disease or diabetes or kidney problems. So many of these health or physical problems are treated with medical doctors, with a multidisciplinary team, with a nurse, maybe a therapist, etc. So similarly, when we talk about mental health difficulties, we also visit doctors, or we may be meeting our general practitioners, but also therapists, nurses. We may have a key worker. If you're a child who has mental health conditions, you may also be associated with an educational psychologist, or maybe an art therapist. So this is all very common, that both of these factors or faculties, mental health and physical health, they're all the same. Now, the reason why we give so much importance to these two factors is because we find that physical health problems significantly increases the risk of poor mental health. And research has suggested that those individuals who face long-term physical health problems, they are up to 30 or 40% likely to develop a mental health problem. Now, that could be in depression, for example, like clinical or major depressive disorder, or generalized anxiety disorders, or GAD for short. So if we were to consider what exactly is good mental health, what does it entail? What we find is that good mental health is often associated with being able to handle or manage stress effectively. So even if you're going through lots of challenges, you're able to manage those. It's not that people who have good mental health have fewer stresses or less environmental factors that are actually affecting their mental health. That's not the case. It's actually very much similar, but the way we're able to manage it or handle stress differs. We also find that individuals who have good mental health are also able to understand each other people around them. They're able to maintain relationships more effectively. They're also able to make more appropriate more effective decisions. So when it comes to making decisions, if your mental health is quite poor, and if you're in a hospital setting, you might find that a doctor may say, I'd like you to sign the power of authority for this individual, because they're not able to make the right decision for themselves. They're not in good health at the moment. So these kind of settings within the clinical settings is very common. Equally so, when it comes to good mental health, we find that it's associated with the ability to feel, to express, or to be able to manage a whole heap of different emotions. It could be positive emotions, negative emotions, neutral, day-to-day emotions. So they're able to manage these more effectively. But when we think about mental health, it doesn't only mean that those who've got good mental health are likely to be a lot happier, or they're just constantly going to be happy, smiley. No, that's not the case. We find that those who have got good mental health are generally able to find a balance when it comes to juggling certain challenges. Maybe they have the support system in place where they can talk to someone and share how they're feeling, and so they're able to manage those stresses far more effectively. Another factor that I think is really important for us to realize is that all of us are different, right? We all have a variety of thoughts, different emotions, different feelings. They're all part of our normal life. But one person's going to be very, very different from another based on their experiences, maybe based on their childhood experiences back in the days. So some may find it more challenging to cope with things compared with others. And when we see mental health, the way I view it is almost like a blueprint or a doorway to the subconscious. So sometimes many people are very good at masking their mental health. So they might be very, very upset about something, and they might be in their homes, for instance. But when they're out there with their friends, they're able to put up a very positive face, very, very happy. So someone thinks, okay, this person's very seems really confident. They don't seem to be having any challenges. But the moment they head back home, the emotions will come out, those thoughts, those feelings will emerge. And this is what we're particularly concerned with. Are we able to be transparent with our feelings and our thoughts? Are we able to say, you know what, today I'm not having a great day, so and so happened, but you know what, I'm just trying to get through the day. So if we're more honest with ourselves, we'll be able to get through things better, and also we'll get enough support from others. So if I was to say that I'm not feeling great today, but I'm trying to get through the day, then it's likely that the person I'm speaking to, I'm communicating to, it could be a family member, maybe a close friend, but they're more likely to be, maybe they'll be supportive during that time. They'll say, you know what, why don't you relax? Let's have a cup of tea and let's talk. So these kind of conversations are actually something that we need to normalize in our communities. Even when we talk about it at work, it's so important that we say, you know what, today's just not the day for me. We need to let's have a discussion about this maybe later on tomorrow. So these kind of honest, transparent conversations are really, really important. So what happens exactly when we experience poor mental health? What are the processes? Well, what we find is when we look at serious mental health conditions or conditions such as anxiety or depression, we find that it doesn't only happen in one setting. So you won't see the signs and symptoms being affected or depleting over time in just, let's say, at home. You'll find that it's also affecting their workplace. If a child, for example, is experiencing clinical depression, which does happen, then you'll find that their academic, scholastic, or performance may be affected. Their ability to, let's say, go to extracurricular activities. They may say, I'm not interested, I want to go home. So you might start seeing a bit of a pattern a month or two before an individual actually expresses full-blown mental health condition. And so it's really important for us to focus on the overall social and occupational functioning of that individual. It's really important for us to focus or pay attention to an individual's psychological well-being. Think about the ways people are communicating. Think about the way it's communicated, the emotional aspect, and also the general social interaction. How much is this individual interacting with another individual, which they used to interact really well with? Maybe it's a close friend. What are their thoughts? How are they expressing it? Are they speaking in very briefly, just to get through things, or are they able to express the same way they used to before? And if you're able to detect change in any of these faculties, it could be in thinking, in feeling, in acting, that's when it's important there should be like a red flag that goes off that this person needs help. I need to talk with them. Let's try to find a way of being able to facilitate that. Because what you typically find is not that a person's general functioning is at 100% and suddenly it goes down to 50%. You will see there will be a gradual decline in functioning, and it will be highly debilitating. It will affect their social functioning. It will affect their day-to-day life functioning, going to work, right? Going to school. All of these faculties will be affected. And so what can we do? What can we do exactly to actually help someone who may be suffering from poor mental health? Well, I think it's really important or critical that we talk to someone. It could be that we talk to a family member who's really close, maybe a friend, a clinician, a general practitioner, Sometimes we might find that I don't want to talk to my family. I don't want my family to be aware of what's going on. Maybe I don't want my friends to know that I'm suffering from a particular condition. So instead, I could always go to my GP practice. I could speak to them one-to-one in a sort of confidential way and try to get help for whatever I'm experiencing. And what you might find is that just like a physical health problem is assessed and monitored and referrals are done, in a similar way, when it comes to mental health, a GP or general practitioner or physician would carry out an assessment. And that assessment will look at anxiety, or look at clinical depression, how your mood is, whether you've ever felt paranoid. All of these thoughts and feelings will all be explored, and they'll subsequently be able to come up with a brief overview of the signs and symptoms that you're probably experiencing. They'll also be able to make a call about whether or not you need any help. It could be medication, or it could be through talking therapies like cognitive behavioral therapy. And sometimes family therapy is really, really effective, particularly when you're working with children and you want to find out the background. You want to find out whether there's anything that's actually leading to many of these signs and symptoms you can see in the young person, but also in adults. So there's a whole range of psychotherapeutic interventions which may be effective, but also drug interventions, or generally a combined intervention, is found to be effective. Of course, if your GP refers an individual for mental health services, or maybe an early intervention service, is really important, because that way you know that I'm actually going to get support. I'm going to get medical advice from a person who's trained in this, in providing mental health support. Those days have gone where we used to think that mental health problems never improve. And we might have had a visual of maybe some movies that we may have watched, or maybe something that we've read, or maybe someone that we knew many generations ago had a mental health conditions. But the fact is that science has improved so much. There's so much more early intervention services that are out there. And so, don't worry about it. If you have a problem, if you're experiencing absolutely anything, just go to your GP, speak to them about it, and they will be able to signpost you and direct you to the relevant services so that you feel better. So like I mentioned, we all need to take care of our mental health and our well-being. Because whether we have a mental health problem or not, our mental health matters. And so I'd now like to focus a little bit on the practical steps of how we can improve or even maintain our well-being. If you feel that you're really, really happy all the time and nothing really bothers you, that's fabulous. Just continue. That's great. But if you find that you keep having to wear a mask when you're outdoors, when you're interacting with people, and then when you're indoors, you're upset, and you really need someone to talk to, then this is something that I think we need to draw our attention to, and we really do need to seek help. So a couple of things we can do is we can make time for ourselves. I call it me time. And the reason why I call it me time is that we're so busy. It could be parents, could be children that are doing their homework, for example, or busy at home, or generally everyone in society. We are very busy. We are stuck in doing things. We're kind of almost lost. We don't give ourselves time for ourselves. So what I'd suggest is give yourself, even if it's like the last hour before you go to sleep in the day, so give yourself that time just to recuperate. Think about, how was the day? Was there anything that didn't go so well? Is there anything where I feel really good about myself? Something that I did. Maybe it's an altruistic behavior, something that I made someone feel really happy today. And just reflect. And as you reflect on these positive things, it will make your next day, the following day, so much more brighter and better, because you would have probably learned something from how today went. If it hasn't gone well, you've always got tomorrow. The second thing I'd suggest is building positive relationships. We are all social beings, right? If we feel that our family is there for us and we can talk to them, it's really important that we talk not only about the positive things, the wins. Let's say as a child, you've passed a piano class, right? One of the tests, or you've got through from green belt to brown belt in karate or something. So all of these things, these are positive things that we typically share with our family. But isn't it important also to share times when we're not feeling so good, when we're upset about something? There's something that's pulling our energy levels down. Maybe there's an individual who's not in the family, maybe outside, that's upsetting us. Is there a way to just talk about it, to just offload? And the reason why I'm stressing so much about this is because when we offload things, our cortisol levels tend to go down. They're typically really high up there, but as we share information, we're able to reduce the amount of stress we're feeling. And of course, we get a lot of support from our family. We might get some indicators. Why don't you do this? Maybe they'll give you some interesting ideas that you didn't think of before. And this can be really, really helpful to get your mindset, a bit more clearer. And you can think about things very, very differently in a more positive light. Something else I'd like to focus on, of course, is that we feed your mind with positivity. Often we get tangled up in so many different things. People are pulling us from one direction to another, and we feel that we're just giving ourselves to different things, and that's fine. It's good to be able to contribute in different areas, but I think it's equally important for you to give yourselves time in the day. It could be early morning, and I do prefer early morning, where you just give yourself that time to reflect about how the day is going, how the day is going to go. Plan the actual the potential steps of what you're going to get done during the day. Maybe watch a motivational talk to kickstart your day, something that's positive, right? Something which will reduce any forms of negative thoughts or feelings. And of course, start to watch the words we use when we communicate with ourselves in the morning. How do you feel? What sort of words do you say? Do you say good morning? Or do you go, oh God, I'm not looking forward to today? So it's the kind of words that you use to describe or how you feel in the morning. It's so, so important. Another factor that I'd like to point out is paying attention to your nutrition. So are you eating well? What's your diet like? Do you find that you're going more towards eating sugary foods, for example? We tend to do that when we're not feeling so great. So not the one-offs, but when we have lots of chocolates and biscuits and ice cream, those are comfort foods. And it's often done maybe when it's a bit doom and gloom, like sometimes the weather is as we're heading from autumn to winter. But also it may be an indicator from the mind, from within, that we're not feeling great. So you're finding ways of accelerating your neurochemicals, your dopamine and your serotonin levels. So keep an eye out and making sure that you have a really, really good balanced diet and you're having all the vital vitamins and minerals. Maybe get a blood test done to check whether or not there's any depletions in your iron levels or zinc or magnesium, etc. Because these things are really important and they're very much linked to multiple positive health outcomes. And they're really necessary for the regulation of many systems in the body. Of course, there's also keeping active. So how much exercise do you do on a weekly basis? Right? They often say about 30 minutes a day is often a good thing. You don't necessarily need to go to the gym or play a sport, but doing any forms of physical exercise, even walking in the park or across the field, it does boost your self-confidence, it boosts your self-esteem, and it helps you concentrate. I don't know if you've ever noticed, but if you've gone out for a walk, suddenly there's so much more activation within the body. You can suddenly focus your attention so much better. You may even find, and that's why I'd suggest that you just think about this, you might find that your sleep is far more better. The quality of your sleep has significantly improved after having had a bit of an active day. So if all of these things are going to improve your general well-being, then why not do it, right? It's something that can certainly help activate a very, very positive mindset. And of course, another thing that I absolutely love talking about is staying hydrated. Did you know that the brain and the heart are composed of 73% of water. Our lungs, right, got 83% of water in our lungs, and our skin, 64%. When we think about our muscles and our kidneys, 79% of water is found in this. And of course, even the bones are all very watery. About 31% of our bones are also found of water. So the evidence, of course, suggests that it's really important to stay hydrated. If you can stay hydrated, just have plain water. It can significantly improve any signs and symptoms of clinical depression. It can improve your general anxiety. And all of you may have seen some videos that have been going on live as well about how to drink water as well. So if you're sat like this, it's better to be sitting and drinking water than to be standing and drinking water. Equally so, it's important that you're not sort of, when you're drinking water, that it's done in a very sort of methodological way, in the sense that it's just slowly you're taking water, gulps of water, as opposed to doing it really like a flush of water. So the slower you do it, the better it works in terms of your general hydration. And a couple of more points I'd like to suggest in terms of improving your well-being is to spend time in nature outdoors. So not only walking, but even just being around nature, it can really help improve your mood. It can reduce the feelings of stress, but also anger, because we get a chance to think about what's just happened when we go out for those walks on our own. But also, we can always bring nature indoors. So we can buy flowers, we can get potted plants, for example, or even seeds to grow into beautiful flowers. And we can leave these in our windowsill. So bringing nature indoors or within our home can actually elevate our mindset. It can make us feel so much more better. So we've talked about drinking water. We've also discussed about going into nature, the importance of being active, paying attention to our nutrition, feeding ourselves with these lots of positive thoughts. I'd now like to focus on our general physical health. So looking after yourself. How much do you take care of yourself? Right? So when you wake up in the morning, have a really nice hot shower, brush your teeth, like do the thing. These are all normative, but sometimes people struggle. They struggle to think of what they're going to be doing in the morning. They find it quite difficult to set the tone for the day. So it might be important to have small goals. So get up and maybe wash your face. Think about maybe one or two plans of what you'd like to do today, those kind of things. So that will really set up the day in a positive way. And of course, many of us, you may have heard that they try to cope with difficulties through alcohol, or they may be taking drugs. Now, of course, this is something that I'd strongly advise that you try to avoid, because in the long run, it can make you feel worse. Because all you're doing is, when you're experiencing it could be a medical health problem, it could be a mental health problem. If you take drugs or take alcohol, all you're doing is you're getting away from your problem. Your problem's still there. So one way of being able to reduce your problem is, of course, by speaking to someone and, of course, getting advice. So that's something I'd suggest. And finally, try to get some really good quality sleep. Establish a routine, right? This will really, really help you get some regular sleeping patterns in place. And just maybe an hour before you go to sleep, try not to have any technology around you, like mobile phones. So be tech-free before you go to sleep. And this will really, really help you wind down. You can even try meditation. Some people really like yoga because it really allows them to relax. And that's something that you could potentially include during the day. Maybe 5 or 10 minutes of yoga, could be in the morning or maybe later on in the evening. And this really has been reported to show significant improvements in our general well-being. So just to summarize, really, mental health problems can help, and it can actually happen to anybody from all walks of life. And so there's nothing to be ashamed of, really. If you experience a mental health problem, just seek help. The only person you need to take care of is yourself. That's the only person you need to take care of. So don't feel guilty for giving yourself that me time. Give yourself that time to be able to assess your mental health, your general well-being, how you're feeling physically. And then, of course, if you do detect that there are problems, then take action, seek help, because it's okay not to be okay, but it's not okay not to seek help, support, and advice from a clinician, a family member, or a close friend.